this facility. I have presented so many times before aortic aneurysm. I'm sure all of you are aware of the earlier diseases which I presented. This I wanted to present because the aneurysm present in two ways. One is patient coming emergency to the casualty where the treatment has to be done immediately, and other patients come as an elective like dilatation of the aorta where we have some time to treat these patients. So when it comes an emergency, normally the initial part of the aneurysm only every center treats, because doing the whole thing together is a very difficult operation, and even in the world itself, this sort of operations are done only maybe in a handful of centers, which is just started only a year ago, because I am involved in the International Aortic Registry in most of the centers in Europe, UK, Australia, and New Zealand, and all those places. So very few places only it is being done. And we were fortunate enough to get this graft imported, and it has been done first time with this graft in this part of Asia only, because earlier this is used only in Europe and USA. FDA has approved this graft only recently because it's very simple to use, but it's a very complicated operation, has to be done by an experienced surgical team. And Dr. Raju also has mentioned about the importance of diagnosing this problem. I'll just briefly run through the aortic aneurysm. That is, this is a dissection, because you can see there is a tear in the wall of the aorta, and blood separates the aortic tissue. And in this particular patient, this is showing the layers of aorta. You can see in the circumference. So suddenly, for sometimes the reasons are not known. Most of the times with patients, the blood pressure goes suddenly, or some patients who are smokers, or the aorta is very weak. The aorta tears in one area. You can see the blood entering the aorta, and then like a small cut there you can see. When the heart is pumping, suddenly there is a tear in the aorta and blood enters into the different layers and separates. So the wall becomes very thin and it can rupture. The video is not moving. No? What's happening in the video? Now what happens is sometimes it could be dangerous. If it ruptures, because the wall is very thin, patient may not reach the hospital. If it is in between, blood is between the layers, means it will take some time for the patient to become serious. Before that, if you treat, patient will become moderate. This is what happens actually. What I was mentioning about is this only. So this is the layers of the aorta. You can see outer layer, inner layer, and the blood just goes from the inner layer to the outer layer. That is called a dissection. Normally, when patient comes with a dissection, this part is involved and all this part are involved. But when the operation, normal cases, people will do this operation only in this part, because tackling all these areas is very, very difficult. That is what the specialty of this case. We have tackled all these areas together. Because if you do this operation first, within a few years, patient may require correction of all these areas. And this is a classical example of what operation is done by most of the places where in a dissection. When it occurs here, you just replace this part and this area is not attended. And if you don't attend, this is what happens. The aneurysm keep on increasing, and these are the patients which I have operated, which have been referred from different centers where this part is not tackled. So you can understand what happens. With only this area they have tackled in all these cases. So patients come back with another sometimes second operation or even third operation. Now this particular graft which we got, we are just showing how we do this procedure. It's called a Thoraflex hybrid graft. This is an animation of the graft where we stop the heart, cool the blood to about 25 degrees, and this is the graft being deployed into this part of the aorta. You can see this graft. that is the lower part which goes inside, and then fixes all the tear inside this aorta, lower part of the aorta. So all this procedure is done when the heart is stopped, the blood supply to the lower part of the body also is stopped, only the brain is getting blood which is at a temperature of about 24 degrees. And you can see, so I showed you the tear in the previous picture, it's all being covered here. Totally we cover, and then with this part, the remaining part of the graft, we replace the arch of the aorta. You can see that the branches of the graft which supply, this goes to the left side of the left hand, this goes to the brain, and now the end of the graft will connect to the heart. That is how it looks once it is removed. It's just an animation, only looks very simple here, but it is not that easy when you are when the heart is arrested and we have to keep the timing. We cannot have too much time to do the operation. So we have to take one of the problems in an acute emergency is these tissues are all very weak. It will not hold the stitches. All these areas can leak and you may require a lot of blood and all those things. Sometimes it will be very hard to stop the bleeding. One of the complications of this operation is uncontrollable bleeding when the tissues are very weak. Now this is the patient which we came to us. Actually, he had chest pain in the abdomen, in the stomach. It was in Coimbatore, and they could not diagnose it initially. So initially, and he could not move his leg. He had problem in walking and pain. So they did a scan only of the lower part of the body. So the moment they told me that from Coimbatore that the patient was referred here. And when I heard the history itself, I told them to do a CT scan immediately because the history is very typical. Somebody having pain and not able to move the leg with the absent pulses. So when we did, we found there is a dissection. You can see this is exactly the picture when the patient came in. Only there's a slit only. Blood coming out of the heart is almost blocked here. The valve was leaking and there was a tear in this aorta there. So we immediately took the patient to the operating theatre and then we did the surgery. I'll just show you the so you can see the color of the aorta. That is what it was. You could see that. See, this is how it looks like. See that the whole blood outside. The picture I showed earlier. This is the aorta. Now we are stopping the heart. When we open, you can see the layers dissected nicely. You can see in a minute. It's like a peel, like a banana peel. It is. See how many layers? This is the dissected part. In the two layers, blood. See this one. You can see that. That is called the dissection, dissecting aneurysm. So when you repair this, you have to use a Teflon cloth material so that blood will not leak. Usually we use a special cloth. And we are checking the valve to find out whether there is any leak. The aortic valve is inside, and then we have to deploy that graft. That is the next step. That is blood flow to the brain. We have to continue because if you stop the olden days, we used to stop the blood flow to the brain by cooling the patient to about 15 degrees. Now we don't do that because sometimes it may be associated with more of a stroke and other problems. So now we don't stop the circulation. We give blood to the brain while we are doing the operation, and that is the arch of the aorta. You can see when we cut, you can see the branches all there. In the picture I have shown all the branches. You can see it in the real picture in the video. So through this we deploy the graft where there is tear in the lower part, in the chest. You cannot see that part. It's pass a wire, through that only we get the graft. All this has to be stitched very carefully because even one